Here's what you can expect in a pelvic health exam for men with Dr. Susie G. Hey friends, in this video, I'm going to walk you through my pelvic health exams for an in-person session. I'll cover what conditions might benefit from pelvic therapy, what you can expect with me, and how I can support you on your journey. So when would pelvic therapy be right for you? If you have any of these common conditions that I'm going to be naming, pelvic therapy and sexual medicine has a high success rate to support and to guide you on your health. So if you have testicle pain, or chronic pelvic pain syndrome, otherwise known as chronic prostatitis. A little aside, chronic prostatitis is a little bit of a misnomer because in 95 to 97% of cases, it has nothing to do with inflammation of your prostate. Okay, moving on. If you have pain during anal intercourse, pain during vaginal intercourse, pain with masturbation, pain after a vasectomy, snip snip, Peyronie's disease, painful ejaculation, painful erections, erectile difficulties, ejaculatory difficulties, including premature ejaculation or delayed ejaculation, groin pain, hip, low back pain, abdominal pain, pain with sitting, constipation, urinary urgency or frequency, bladder pain, pressure or discomfort. And if you're experiencing bladder or fecal incontinence, pelvic therapy is certainly a conservative treatment option that you should definitely try. My approach is thorough, collaborative, and not rushed. You get to lead the way and share your most intimate concerns in a safe and non-judgmental space. Dealing with pelvic health issues and sexual health concerns can be very overwhelming and frustrating to say the least, especially when you reach out to medical providers who do not validate your concerns or work with you collaboratively to find a recovery strategy. Dealing with pelvic health and sexual health issues can be very overwhelming, frustrating, and it can feel disheartening sometimes, especially when you go to medical providers and you don't feel like your concerns are being validated and you are not given a treatment strategy or tools to support you in your health. So during our time together, I want to know what's most important for you to address during our work together. This means that this is a collaborative partnership and that each session we work together on addressing your personal concerns and your health and wellness goals. And because you're a whole person, not just a bunch of physical body parts strung together, my approach is three-pronged. We get to explore the physical aspects of your concerns and also consider the psychological, the emotional, the social, cultural impacts, your relationships, the environment, on you as a person, your relationships, and the concerns that you're coming in to see me with. Most providers won't ask, but I want to know how your sex life has changed since you started experiencing your health concerns. Or maybe you've noticed things are a little different and want to have an opportunity to talk about your sexuality and your sexual health in a non-judgmental, safe space. Let's be real here. No one is asking you about your sex life, and sexual health is an important pillar of your well-being. Questions around race, religion, spirituality, gender, culture, and your values also influence your perspectives on sex and pain and body image. And so I want to know how all these factors influence your life and you as a whole person. We may also dive into your past sexual relationships and experiences because all our experiences shape our pain and our sexual health concerns that we might be experiencing. Does this sound different from any other medical exam that you've had? Well, I hope so, because there's a lot to consider beyond just the physical, the biology that play a role in you and the issues that you're coming in to see me for. Based on your story, I then tailor an individualized pelvic and sexual health exam. But before we dive into those details, I want to make sure that you know exactly what the physical exam is going to entail. And so before we go onto the treatment table, I will definitely be sharing with you my knowledge about the pelvic area and walking you through step by step what we're going to be assessing and why, so that there are no surprises. At any point during our interaction, if you feel that there are feelings of anxiety or some other triggering emotions that you are experiencing, or hesitancy or reservations about the exam, please know that you have all the permission to say no to any part of the exam. This is a consensual exam, and I will be checking in with you to get permission to touch your body and to assess parts of your body that we agree upon together. So before you get undressed and drop trowel, we will definitely be looking at your whole body, and that includes looking at spinal range of motion and movement, your belly, your back, your hips, and how your body likes to move, and gathering information about where in your body might there be an added protection or guarding that may limit movement, function, or contribute to the situation and concerns that you're coming in to see me with. So we really take a wide lens, full body approach, and we assess the movement aspects of your health first, and then we proceed to the pelvic health specific examination. So when we're both ready to assess the down below, this exam is going to be based on your concerns and what you're comfortable sharing with me. This exam may or may not include the following: a genital assessment where we assess foreskin health. If you are circumcised or not, we will be looking at the skin of the penis. We're also going to be addressing genital tissue mobility, erectile tissue mobility, and mapping out any tender areas or points. We're also going to explore sensation and your overall body awareness of this organ. We then are going to map out other areas involved with the pelvic floor. So everything in between your butt bones is something that we will explore, and particularly again, mapping out what hurts, what feels neutral, and maybe what feels good or pleasurable. We will also be addressing function. So just like your hand has the function to contract, to close and make a fist, and also to relax and open, your pelvic floor muscles also act in the same way. They squeeze to contract and they let go. But there's also an active lengthening or an eccentric contraction, which is the bearing down portion. And that's where you pretend like you want to have a bowel movement or let out a fart. And I tell people here with this part of the exam that if you do end up farting, it's on me because I asked you to do so. So now on to the internal. If appropriate, based on your health history, and again, always with your consent, an internal exam may be offered. And when would it be appropriate to do an internal exam? Certainly with your permission. An internal exam might be very reassuring for you because it is a completion of the pelvic health exam. But an internal exam might be warranted if you're experiencing difficulty having a bowel movement, if you're experiencing pain with bowel movements, or if you're experiencing pain with anal play or anal penetration. Or maybe you have this really deep ache that feels like it's in your prostate, and you would like us to assess the musculoskeletal contributions to that experience that you're having. Maybe we assess your pelvic muscle function and coordination, endurance with an internal exam. So there are many things that might be appropriate to assess based on your individual concerns, but by all means, we do not have to do an internal exam or treatment because it is just one of the many options that we have to help you feel better. So now to address the big elephant in the room. Dun dun dun! Erections! Don't sweat it, fellas. Erections are common. It is a normal physiological reflex that may or may not occur during a pelvic health exam. And your health professional, like myself, are equipped to handle such situations with compassion and grace, knowing very well how uncomfortable or how awkward or perhaps embarrassing that might be for you while going through the exam process. So please do not worry about getting an erection. I completely know that that is a physiological reflex that may or may not happen, and that we will address any discomfort that you might have during the exam, and I will offer the appropriate space and graciousness to work with you should that happen during our session. And since we're talking about erections, let's have a conversation about ejaculation. Spontaneous ejaculation may occur during a session as well. Again, don't sweat it, fellas, because we will handle the situation in a very professional, compassionate, and gracious manner. And so please note that your health provider, like myself, is well equipped to handle situations like these, and we will approach the subject in a very professional and down-to-earth manner. So after the physical exam, we gather up all this data and we discuss the findings from our session together. We then also talk about initial next steps to get your wheels rolling on your journey to recovery. Treatment strategies may include manual therapy, strengthening exercises, relaxation exercises, mindfulness techniques, body awareness practices, reflections such as journaling, stretches, nutrition, sexual counseling and education. The list goes on and on. It is just based on what you need with who you are in this place and time. We will map out your goals and create many attainable goals because it's so important for you to be able to track your progress and to celebrate your accomplishments. I'm often asked, how long will this process take? How long will it take for me to see improvement? And while there's no real time frame on healing, it may take one session, it may take several sessions. We just don't know until we start the process and gain some momentum. Every person is unique, and their healing journey is just as unique to them as their thumbprint. So each time you see me, we will evaluate your progress together, and we'll keep tailoring the approach to you, with who you are, with where you're at in that time. And just in case you're not able to see me in person, don't sweat it, because I do offer virtual consultation and coaching sessions online, and we will go through your medical history and your sexual health intake together, and I would be able to provide you with my understanding of the situation and provide strategies to get you on your way. And that might mean connecting you with local resources, sharing of educational materials. And I could also do sexual counseling and coaching online, even if I'm not licensed in your state. However, in order to be a practicing licensed physical therapist, you must be in a state where I am licensed in. Again, otherwise, we have online consultation and coaching strategy sessions that are available for you to use no matter where you are around the world. And maybe you're not ready to dive into those details quite yet, but you want to pick my brain and ask some of the questions that have been on your mind. The 15-minute call is for you. In this call, I will listen to your concerns and your questions. We'll have a conversation, and if appropriate, I would be happy to share resources for you and connect you with healthcare providers in your area should you feel the need to see someone locally. And if you're a do-it-yourself kind of person and you like to go at your own pace and follow videos and handouts and try things on your own, or maybe you're just not ready to drop trow in front of strangers yet, the online pelvic pain relief program for men is a great stepping stone to get all the education that you need to learn about your pelvic health, your sexual health, and you also get a 30-minute support call with me for personalized guidance and support. And lastly, no matter which option you choose, my book, Pelvic Pain, The Ultimate Cock Block, is an educational resource and guide that complements any way that you work with me or even with other healthcare professionals. It's an in-depth dive into the science behind why you hurt and practical advice that you can put into practice right away. It's available in an ebook version and also paperback. So regardless of what issues you're coming in to see me for, remember that this is a crock pot process, not a microwave. You are an active participant the whole way. I tell people that you are in the driver's seat. You type in your destination into your GPS and you go on your road to recovery. I'm like the rumble strips on the highway. I help to keep you steady in your lane, steady on your course when you tend to veer off of your path. And so I am here as a guide, as a support, and a source of accountability to help you along your health journey. So if you're ready to work together, click on the links below in the description of this video and let's go. Thanks so much for watching. If you found this video helpful, please subscribe and hit the like button below. This will help other guys in your situation also find these resources sooner than later. If you're a penis owner who's currently struggling with pelvic pain, you're not alone. Check out the Men's DIY Pelvic Pain Relief Program. The link is in the